Hello, everyone. Thank you for joining us live for this effective communication with healthcare regulations event, or maybe you will be watching this video on a recorded basis. So a warm welcome also to the one that will be watching the event afterwards, because you could enjoy live. So delighted to be with you today, and I'll be talking with Eric Klasen, somebody that knows an awful lot about communication with healthcare regulators. Eric and I also been collaborating a number of times towards workshops in the field of communication in healthcare, and we will tell you a bit more about this, and we will also ask Eric to introduce himself. But before, we want to know a bit more about our audience. So maybe tell us something about are you an healthcare professional working in healthcare, or are you maybe coming from another sector and you just are coming because you're interested in communication as a broad concept? And maybe tell us from where you're connecting. So, we want to know a bit more about our audience. And you have the chat box on the right side. So, if you tell us something about where you're connecting, or whether you are a healthcare professional or not, then that will give us a better idea about our audience. So, a warm welcome again to you all, and especially warm welcome to Eric Klasen, that will be with us for this LinkedIn Live. Um, Eric, maybe can you say a few words about yourself so that our audience understand what is your background?
Thank you very much, Giuseppe, and thank you for inviting me here in this forum. My background is at the moment I'm a consultant. I'm formally retired. I have more than 45 years now of experience, and I still like to continue to do that. My last 15 years were Vice President Regulatory Affairs and Quality with Medtronic for the European and Middle East Africa region. And before that, I have worked as head of global regulatory affairs for Novartis Consumer Health. I worked in the diagnostics industry as more in product development, and I worked for the biologics industry more in manufacturing support, and the biochemistry, biotechnology industry. I was indeed quality and quality assurance and regulatory. I started for the first time to do when I was head of regulatory compliance for the vaccine industry in Italy, Chiron vaccine that was. That's in short my 45 years.
Wow, 45 years of experience in healthcare. Amazing. By the way, I had the pleasure to meet Eric around 20 years ago. We were both working together at Novartis, and I was so much impressed by the way that Eric worked that we continue to stay in touch, and now it's a pleasure that we continue to collaborate together. Fantastic. Now, you already briefly mentioned to our audience, your vast experience. So, with which healthcare regulators did you communicate during your careers?
Oh yeah, that's a good point. There are many kind of regulators actually. So the healthcare regulators I communicated with, if I look at the list myself in my mind, then starting with the agencies such as FDA in the US, which when I was in vaccines, I had connection with them. But later with medical technology, medical devices, it was more the regulators in the countries. So BfArM in Germany and MHRA in the UK, or ANSM today in France, but also INVIMA in Colombia, or other agencies in the world in Japan. Those are the typical regulatory experts. And then you have the ministries of health, which I also had several occasions to meet for different reasons. So those are also regulators. And then you have on the medical technology side even notified bodies, because they are sort of the gatekeepers for medical products going to the market in Europe. And you need a CE certification from them for certain risk class devices. And so then you have a lot of contact on the pre-market side with notified bodies. On the post-market side, a lot with the regulatory authorities, so the ones that have the agencies, because they are responsible for post-market surveillance. So that's a little bit the people. And then you have the European Commission, of course, that maybe and occasionally you can have some kind of meeting with.
Wow. Okay, that's quite a broad kind of things. Now, what do you focus on in this discussion? I mean, I know it may be different from one to the other, but let's say, is there any common theme? What will say, yeah, what is the focus, we'll say, of this discussion?
Yeah, the focus is often either you need something from them or they need something from you. Now, that's the point, because when you need something from them, like information, regulations are regulations, and we all know when you read regulations, there are ways of interpreting them. So you ask the authority, how do you interpret this rule or this requirement? That is when you need information from them. And that's mostly for understanding how you bring your products to the market. So on the pre-market side. On the post-market side, it's often the other way around. They want information from you because they are responsible to surveil the market. And so they have questions when they see adverse events coming in for pharma, or they see product failures coming in for the medical technology. They ask questions: what's happening? How many products did you sell, and how many complaints did you already receive? So there is an interaction for these two. And then you have a third way to reason to meet them. It is when you want to influence them on new regulations under development, under construction. And you hope that this regulator, you want to know what's their position in it, and then you want to influence them maybe by your position, your more industry focused opinion on the same sort of regulatory change.
Okay, well, I like the third piece in particular, right? Also because it builds back to my expertise in negotiation and influencing. If you want to make something happen, probably don't count on trying to convince everybody at the meeting itself, or try to challenge something which has already been published, but be there involved at an early stage. So you're making a presentation to the board. Don't try to get the buy-in from all the board members during the presentation, but have individual discussion with the different members beforehand, so that you're going to have some allies, you're going to have a better chance then your proposal will be accepted. So with that in mind, going back to what you were discussing, I mean, so okay, you mentioned those three broad categories of focus. I mean, what do you try to achieve in this discussion? Information for them, try to influence them in their opinion regarding your products. Can you maybe go into a bit more details on this?
Yeah, I think there are normally what I do. Many people, what they do is they go in for one specific reason. Either they want a specific information on a regulatory interpretation, or they're called to the authority because there is an issue with one of their products on the market. I always try to be sure that I have at least two subjects. One is the official one. That is the one that you send them the question, or they call you to their office, because these are opportunities that you should not waste. These are opportunities to maybe, there is always an informal little piece, like a cup of coffee, or at the end is it is saying goodbye, shaking hands and walking to the corridor. And before you're at the front door, you can already ask another question. And that is then, for example, what do you think about this new regulation coming up and this change? What is your opinion on it? Then you have automatically a second way to create a relationship and to have another point on the table, that if you cannot knock on the door and say, I want to discuss this regulatory change. Often they don't want that. But as they call you for a product issue, you have an opportunity to sit face to face. Don't miss that opportunity.
Okay. Amazing. So, I mean, again, linking back to negotiation and influencing, one of the advice we give is be the one who propose the agenda for the meeting when you have an internal meeting, a negotiation, or influence, etc. But even in a situation like this one, when you're called by the authority and there is already a preset agenda, you can have your own points already prepared, and even if formally you cannot set the agenda, you can find a way to bring your topics into the agenda. Fantastic, Eric. Thank you. I mean, since we like to talk about concrete things in our LinkedIn life, that's why we call into people with real life expertise. Maybe can you bring an example of one of those discussions?
Yes, I have many examples. Let me see. Okay, there's one, for example. This is a very funny one, because we went into the discussion with an agency with a very simple question. Can we discuss an update? What is happening with your new medical device regulation? This was in South Africa. And we knew that this was we didn't have any product problem on the market. We knew that in South Africa they had a problem. They had no specific regulation for drug device combinations. They were all called drugs. Well, most of these drug device combinations in Europe, in the United States, in Japan, and other parts of the world, they are devices because the drug is only an ancillary component to the device. But they didn't have a regulation, but they claimed that they had written it already for 2 years. And then we were wondering what's happening. Then you go there and you think, how am I going to put pressure on them? We did it by preparing a law case, a serious court case. We had everything ready. The court was not yet informed, but the lawyer was informed. We had all these so-called affidavits, which is the testimonies from experts. We had an expert from Europe, a former head of agency from a European agency, which is quite heavy to have such a high level name. And we had a medical doctor from South Africa who was very famous, all claiming we should have a regulation for this. When we came into the office, we had been going through the city, of course, before coming there, and I discovered that it was in October, that this is the city of the jacaranda tree, beautiful blue flower trees. So we opened the discussion by talking about this jacaranda tree, and by luck, the representative, the head of the agency who was meeting with us, was a lady who was extremely interested in this jacaranda tree. So we had a very interesting discussion, and that softened the hard message: we are going to take you to court. But then we managed, after the soft message was not soft, it was a hard message, to change it into, I cannot make a deal with you. That is not my role. I'm not allowed to make a deal. But is there no opportunity that we don't yet go to the court immediately, and you take some time to ask your minister to look at that 2 years document, which is lying there for 2 years, and sign it. And actually what happened is that the whole atmosphere changed from a shock to, why not? If you don't submit anything to court, that means there is time, and that means nothing is happening in the meantime. And we came out a couple of weeks later with the message that the minister had signed off the regulation that was indeed lying on his desk in this case for 2 years. So I think it was a win-win for both industry as well as for the regulator herself, because she was extremely surprised that it was suddenly signed. But it was maybe the way that we managed to agree on an outcome. This was a very, very interesting meeting, and it was a very good outcome. But I think there was one aspect. It was the way the meeting was opened with a wonderful discussion on a jacaranda tree, which apparently was one of the favorite subjects of the regulator, which we didn't know.
Mm-hmm. So, I mean, so the most important thing in this conversation was the threat to go to court, or something else.
Yeah, actually, the threat to go to court, we were upfront, of course, convinced that this is going to be a very hard message, because you don't do that easily. On the other hand, the whole situation softened up because of the introduction. That was an extremely pleasant one, where we got a historical explanation from that lady about the jacaranda tree. She was quite informed on all this. And at the same time, it was not that we go to court tomorrow. We can wait, but we are ready to go. But please, can you use this time to put some more pressure in your organization to get the minister taking a few minutes of time to sign off something which seems to be ready? And that was, I think, the way it ends then up in a very pleasant relationship. You're sort of helping each other to get a job done. And I think this is always what is important in all these conversations. You are two people with, of course, you have a different role in life, but on the other hand, you have some commonalities. And the common thing here was clear. Industry wanted a regulation, and also the agency wanted a regulation, but the ministry had to approve it. And then you see that then you have a common ground. And I think that this is what the previous speaker in your session last week said, and that was striking me as an interesting phrase, and that's why I tell you this story. She said, when there is no alignment, there is no room for partnership. And I thought, yes, that was exactly here the case. There was an alignment, and therefore there was room for partnership. And that was a very interesting, I thought it was an interesting statement she made in your weekly, in your session last week. And that was on procurement and on a totally different subject. But I thought it was a common statement we can use also in the field of how you communicate with regulators. You have to look for an alignment before you think you can have some form of collaboration or partnership.
Yeah. So let's take a couple of key elements, for our audience. One is that you can learn also from people in other sector, right? You can, you don't have to stay. I think it's one of your strong points. As you communicate, Eric, that you don't just stay and try to limit yourself to your sector. You can learn from everyone. And the second is this idea of focusing on building the relationship. And I'm asking the question to the audience, as you are called by the authorities, do you go in all worried? Maybe your body language start conveying that you are uncomfortable and are afraid about the discussion, or do you go in there in with a positive attitude? You take a time to build the relationship with the other person, and then you're gonna have a different type of discussion with your counterparts. I'll let you reflect about what is your own attitude, and maybe there is something that you can take from this. By the way, yeah.
You're hitting on an extremely important point, Giuseppe. This is so critical. The way you feel when you go into a communication, into a discussion with a regulatory authority, and the way you dress, your verbal language, your body language, everything counts. Everything is important. Um, and it all boils down to you must have respect for the other party. The other party should also, of course, show respect for you. But a lot of it comes also when you are the sort of the party that is subjected to the authority, because they are the authority and you are a stakeholder. That you from the start you have to think very carefully. What do you do? How do you dress? How do you go to an authority? How do you meet in their offices? How do you behave? What is your tone of voice? What is your your facial expression? When they say something, don't make a face like, oh, what are they saying now? This kind of body language is very bad because it sort of gives already sets a wrong tone in the communication. Be attentive, listen carefully, but be okay, of course, also clear on what you want to say and what your arguments and positions are. So you get an equal level playing field.
Well, Eric, I mean that's a very interesting topic, and maybe let me dig a bit further because, for instance, often, maybe when you go with regulators, you will go in as head of Middle East and Africa, but you probably had a local colleague that will go in, etc., etc. So, how would you prepare those kind of things? How will you ensure that also the team, feels in the same way, approach the discussion in the most appropriate way, is dressed in the most appropriate way? I mean, from a practical point of view, how will you deal, if you have a discussion, in Germany, in France, in the UK, or whatever, and you're there with your colleagues? What will be the kind of approach to get the team in the right mood and the right setup?
It is really to prepare them. You have to go through a sort of rehearsal, and of course before you can do that often the evening before. That's the best way, so that the next morning you can still have a breakfast and feel relaxed because you're prepared. Some companies, they do that in the morning just before going to the agency, which I think can be more stressful, because that is maybe not the right way in the right moment. But also watch how your team is behaving. Don't laugh about it. When I have sometimes said to people to bring this kind of things to the office when you meet with a regulator, and not a very expensive ballpoint. I mean, these are all small things. It is very disruptive. Industry is sometimes looked as, oh, they have all big money and whatever, but then also don't show it. Then don't be careful with those things, because it is let's say not respectful. It is a little bit out of place, and you have to be careful with that, because some people are more sensitive than others. Some don't care at all. From the regulatory side, the regulators don't care, but some do care. So be respectful of that and be sensitive to that. Think about it.
Wow, excellent, excellent. Just, before we continue the discussion with Eric, I want to say one thing. This is your LinkedIn Live. So, feel free to ask a question, because we are there, to meet your needs. So just use the chat. We just have Kirsi. Hello, Kirsi. Good to reconnect with you. They just raise a question, and feel free to ask some more. But just as before, as we give you some time also to write a question, if you have one, let me tell us also about our next events, our next LinkedIn Live. And as I'm teaching negotiation and influencing. By the way, Eric and I also are teaching together negotiation and influencing in healthcare. We have a first intervention in October at the Regulatory Affairs Global Conference uh, in the Netherlands, and then in November we have a negotiation and influencing in healthcare workshop in Brussels. So if your company needs something about the negotiation and influencing, don't hesitate to uh, contact us. But let me tell you about the next events. If you want to learn some more for free, just join the next event. And next Thursday at 2 o'clock Central European Time, seizing everyday negotiations opportunities. Now, I will be interviewing a professor from the US, George Mason Professor of Negotiation. She used to be also the negotiation professor at IMD in Lausanne. She has published several articles on negotiation on Harvard Business Review. So, she's a big shot. And we'll be talking about seizing everyday negotiation opportunity with Susanne de Yanas. So 8th of September, 2 o'clock, and the link is on the chat. So feel free to connect on the link on the chat for the next event. And then, the next opportunity, the 22nd of September, I will be running a webinar. So I will not be interviewing someone, but I will be talking about who should make the first offer in a negotiation. 22nd of September, 1 o'clock, who should make the first offer in a negotiation? Maybe you can already ask the question yourself. What will you do? Will you make the first offer? Will you let the other person make the first offer? Is one of the most heavily debated topic uh, in the world of negotiation, and there is a lot of science that help us to make the right decision. That we will discover in this together, 22nd of September, 1 o'clock. Okay, so with that in mind, let's go back to Eric, and let's take a question from Kirsi. Hello, Kirsi. So background work done good. Do you have experience that regulators sometimes do not have all the required knowledge of the very special topic? So your introduction and letting regulators ask questions is important?
Absolutely. Absolutely. Very, very, very good point. This is extremely critical. How you imagine if you are working for a company, you know the products. And if you have, let's say, a portfolio of products, you already are happy that you understand them all. But can you imagine that you are a regulator and you're sitting in an agency like BfArM or like ANSM in France or MPA in Sweden? How can you know all the products that are on the market when your responsibility is to do market surveillance? You hear that there are product problems like adverse events for pharmaceutical products, or there are complaints for technical issues with the medical devices. It's not possible that you know all the products. So be very well prepared that you ask the regulators, is it okay if I give first and someone from my technical team gives an introduction to the product, explains how it works, what it is, if it's a pharma product, and what are the clinical studies that were done, and what were the adverse events already reported in the labeling, and then have a look whether the adverse event that has been responded on by the authority is actually already in the labeling or not, and if it is something new. I think it is extremely important that you have the opportunity to introduce your product, whatever it is, to the regulators. And in my view, all the regulators agree on it as long as you don't consume all the time, because they need time to discuss with you. And if you nicely fill it up with a beautiful explanation on your product, then they don't have the time to ask all their questions. So be respectful to that, keep it short, but precise, and focus on those aspects of the product that they need to know in order to discuss the subject for which you went to them or for which they called you to come to them.
Excellent. Thank you, Eric. We have another question. Let's see. Hi, Eric. Thank you for your time and expertise. Do you have any advice on setting up effective engagement models with regulators for strategic collaboration? What has worked well and what hasn't?
Now, this is a very difficult point. When it is on strategic collaborations in the broader sense, like new regulations, like we had in the medical device world, the new medical device regulation, we discovered as industry it was very difficult to set up strategic collaborations with authorities because they were just all thinking about it themselves still. But still it is possible. And as I said, try to use any opportunity that you have to meet with them, even if that is not for this specific kind of discussion, to expand a little bit on that strategic, let's say, aspect, that strategic subject that you would like to discuss, and try to see their interest in having a separate one-on-one or a small meeting to have these strategic collaborations. Sometimes it is good to have it one-on-one, because also regulators sometimes want to hear you, but they don't want to have a lot of other people hearing the same. They just want to take in and understand what the position of you as maybe industry is versus their own positions. Sometimes they like it when their team is present to hear the same thing. So they can afterwards, when you leave the office from them, discuss your position and have their own view on it again. But then they all heard the same thing, so the person doesn't have to translate that to his own or her own team. So what works well is try to make opportunities. If you formally try to connect to them and say, can we have a discussion on this subject? Often they say, yes, but please do that through a trade association. And then you have the problem that you are in a trade association. Sometimes the positions are more diluted to the common elements of the position. And then you maybe do not get that piece where you really want to talk about. That is maybe very specifically important for your company. And that's how I read this question, that it is not a broad industry position, but maybe a specific strategic collaboration with the regulator on something. But I think there are opportunities. Direct asking, is there an opportunity to discuss this? And if you feel that that doesn't work, then use any other opportunity when you meet with these regulators to again try to introduce this subject and see if they're any way willing. And the more they trust you and the more they see you as a transparent person who understands what the role of regulators is, that is to ensure safety of products on the market. That is their role. And of course, when they are also responsible for approving products to the market, they also want to ensure that the product is effective. The efficacy or the effectiveness, as we call it in medtech, is absolutely guaranteed and demonstrated by either bench testing plus clinical studies, or only bench testing in some cases, but mostly also clinical studies. So understand their position, understand that, and be sure that you have that information if needed, but try the two sides through the trade associations, but understand that it becomes a diluted kind of position often that you get, because it is logic. They have to take in all the positions from the big companies, the small ones, and the very small ones. And then sometimes that's not always on the same page. What worked well is try on your own every opportunity that you have to meet with regulators, either at conferences, workshops, participate to that. Put some time in workshops, put some time in going to conferences, sitting in a panel, participating. In a panel, you're equal to the regulator, but be respectful. And the more you are publicly respectful in front of an audience, the more the regulator will appreciate that position. And then you have a chance that you can get a fair, open discussion with regulators instead of confrontational, which is, of course, the worst that you can have, is totally ineffective and not productive. I don't know if that answered the question for this person, but I hope it does.
Absolutely, Eric. That was very comprehensive. By the way, if I take, the negotiator perspective, I would like to stress this idea of putting yourself into their shoes and try to understand what is important for them so that you can get them to do what you want in their own interest. So, if you want to have a strategic collaboration, will it be important for safety? Will it be important for the effectiveness of the product? And if this is something which meets their needs, then you're going to have a much better chance that they will be interested in what you're proposing. So, yeah, fantastic point. Thank you. And we have our common friend Marta, which is also asking a question. Wonderful to see you again, Eric. During advocacy effort related new technology in healthcare, what will be the most important rules or codes to follow?
Thank you, Martha. Good to see you, although it is a picture, but good to see you again. When you do advocacy, in fact, I've always myself stated that there are 3 golden rules that you need to follow. When you want to advocate for something, you need to have your position very well defined. That means you must have the message or your statements very well defined and supported, substantiated with either evidence or with very strong rationale. That is one. And that can be done by the people who know your technology, who know your products, and who know what are the critical and important things of that product. The second is you have to decide which channel am I going to put that message in, or these messages, if there are more than one. Is it the ministry? Is it the agency? Is it the European Commission? And then even at what level? Are you going to the president of the European Commission? I don't think they have much time for listening to us. So they're very busy with many things. So you have to define what is the channel. That means you go to an agency. At which level of the agency are you bringing in your message? And then the third one is, so I call that channel management. It's very specific. And then you have to decide who is the messenger. Is it me? Is it someone else? Is it my boss? Is it someone else? Is it someone from the trade association? Is it someone that you found, a medical doctor who is extremely interested in your technology and extremely understanding the importance of it? Is that maybe the best messenger? So you have the message, the channel, and you can have multiple channels, but then you need also to decide multiple messengers, because not each channel needs the same messenger. And very often, myself, when I had a good message, I try to find who was a better messenger than me. And that is very important. You have to be able to say, I am not the good messenger for this message or for this level of channel. Be very important that you cannot be everything, and you have to be very clear on that. So the 3 things are for me the codes to follow: message, channel management, and the messengers, very carefully selected.
Fantastic. By the way, and this idea of the last point of the messages reminds me about the rhetoric of Aristotle. You probably heard about ethos, logos, and pathos as the 3 messages from Aristotle. Now, people often confuse ethos with ethics, but in the rhetoric of Aristotle, the focus of the ethos part is the messenger. Let's say the person that is giving the message. Do they have credibility? There is a relationship of trust with the counterpart. The personality match. Is this person famous? And those kind of things. So, you can think about, based on past history, personality understanding, and et cetera, finding, the person that best match for the communication. Excellent point. Thank
Yeah,
you. By
I
the
love
way,
that one, Giuseppe, because that's the one that I used also a lot. The logos is the message, it's the rationale. The ethos is the messenger, is the person, and the pathos is the aspect of how can you put a chip of emotion into the discussion in such a way, carefully balanced. I mean, emotion can be also too much. I would call it more passion, but in Aristotle's description, it is often considered as an emotion. But I think he should have probably meant today passion.
Yeah, fantastic. Thank you. Listen, I mean, we are already running quite a lot, but let me ask you a couple more questions. Let's see if there is one more question maybe from the audience. So, what is critical in communication with regulators, Eric?
Very critical is to be honest, transparent, trustful, to be trustworthy. Very simple. If you are not trustworthy, then why would they trust you? And why would your message come across as believable or acceptable? And why would they listen to it? So it's very important to be honest, to be trustworthy, and to be clear, transparent, and listen. Listen to what their part of the picture is. How do they see the picture? Be very well aware of their role and their background, but I think that most important is that they understand what they have to stand for, what their responsibilities are. Listen to how they frame their opinion and their position, and be very, very clear and transparent. But most of all, build a relationship. Also try to build a relationship, even if you come in that office for the first time. You must find a way. Yeah, you have normally, I say, from the front door to their office. If by chance they accompany you from the reception to the office, and even if that is not the case, but you meet them for the first time walking into their office, between shaking hands and sitting down, you must find a way how to at least build a form of trust. It's not easy, I understand, but it has to come genuinely. That's also another point. Be genuine, be authentic. Don't play games. You can study a lot of things, but at a certain point, you have to feel this is me. I'm not here for some kind of theater role. It's me, full stop. But it's that honesty and transparency and trustfulness that is very important in building a relationship and communicating with regulators. If they don't trust you, why would they give in to whatever you want?
Absolutely. Because, those relationships are long-term relationship, right? It's not one-off kind of things. You're not buying, a table at the flea market, is the kind of people that you will be dealing with over time. And, the more they see you and respect you as a human being, the more this will make it easier. Even when you will end up having adverse events, you will end up being, in difficult situations. And maybe, to conclude, as a last question, um, something a bit different. Have you ever been surprised by a regulatory authority in any of these communications?
Yes, that's a good point. Yes, sometimes. Yes, I have been sometimes surprised really about the fact that you can build that trust to the extent that it surprises yourself. And I can give a very short example. I don't want to go into detail, but I had to meet the Minister of Health to inform the minister on an emerging situation, public health related, but not anything related directly with the products that I was working for. We met in the office of the minister, and I could explain the whole issue why I was informing the minister. The minister had a lot of questions, and I gave a lot of answers. And at a certain point, it came to the minister taking a sort of a pause and thinking, and suddenly asking me, "But Mr. Klasen, what should I do?" And I found that, honestly, a surprise opinion, a surprise question to me, that you built in half an hour such an amount of trust that they see as if you are almost part of their team. And I thought that this was quite an example of how, if you are honest, transparent, and clear, that you can suddenly build a relationship in a very short time with a person you had never met before in person. And you sit in an office with a Minister of Health, one-on-one, and you get that question, what should I do? My answer was, I cannot recommend that. You are the Minister of Health, but I gave you a lot of information, and I'm confident that you are able to take that decision based on technical and probably also some political basis. And then I was thanked and I left the office. But that is what I went out and I thought, wow, that was a surprising comment from the minister. I would not have expected. I would have said, thank you for the information and goodbye. And this was an interesting case.
Wow. Thank you. Thank you. By the way, if you're attending regulatory affair the RAPS regulatory affair conference in October, then you will have the opportunity to connect again with Eric, with CABL for some more learning. I mean, Eric and I will also be doing negotiation and influencing in healthcare in November in Brussels. And if you're interested in a workshop for your team to strengthen the negotiation and influence skills, then do drop us an email. We'll be delighted to discuss this further with you. And to continue the learning, just remember next week, 8th of September, 2 o'clock Central European Time, seizing everyday negotiations opportunities. A leading negotiation professor, Susanna Dayanas, published lots of Harvard Business Review article. This is one. This will be based about one of her last Harvard Business Review article, seizing everyday negotiations opportunities. Or, by the way, if you sign up and you cannot join, you get the recording. Next opportunity: who should make the first offer in a negotiation? 22nd of September, 1 o'clock. It will be a webinar run by me. If you're not sure whether you should be the first, when you're the first, when you let the other party go first, how to deal with a counter offer, and how aggressive should be your first offer, what kind of element should be included in your offer, and all those kind of things, then join this webinar 22nd of September, 1 o'clock Central European Time. And as we finish this, let me take the opportunity to thank Eric for being an amazing guest and giving very practical advice to our audience. And wish you all the best to all of you. Thank you again, Eric, and look forward to reconnect next week for our next LinkedIn Live.
Thank you. Bye-bye, everyone.
Bye-bye. Thank you.